Hello, this is Dr. Martina, your online sex therapist. When I introduce myself as a therapist, I a lot of times I hear the comment like, "Wow, that's great. We really need you," and that makes me feel good because it appears that there's a clear purpose or a knowledge of a clear purpose for sex therapy as there is for psychotherapy. And then I hear comments like, "Do people really work on their sexuality?" Or even worse, what do you do in sex therapy? Do you have sex with your clients? So I am aware that there's a lot of misinformation and a lot of judgments or ideas about what sex therapy is. And that gives it a stigma. And that actually does not help people to make that initial call. So it is, we had a stigma on psychotherapy 30 years ago. We thought somebody had to be crazy in order to go to therapy. I thought that 30 years ago. So I understand it's here, but I make it my mission to remove that stigma. And I hope you will help me by watching this video and learning the whys and the hows of sex therapy. Psychology is the science or study of the mind and behavior. When you go to psychotherapy, you're looking to treat a mental or emotional disorder. There's no confusion about this, no misinformation, and most people agree that all of us need to go to therapy, that going to psychotherapy is a good thing. Over the last 35 years, I've taken advantage of various therapists to help me with my emotional challenges, and I will continue to do so because I want to evolve every day. Now, sexology is the science or study of the sexual mind or sexual behavior. If you're seeking sex therapy, then you're looking for treatment for a sexual disorder. And this is exactly where the confusion comes in. Because the dictionary's definition of sex therapy is that it is a treatment for sexual disorder based on psychological causes. And that is just not true. A lot of people think that every sexual challenge is based on a psychological cause. And what most sexual challenges that we experience in this lifetime are actually based on completely lack of sex education. Sex education that is positive, actual, explicit, and clear. It is not that there's something wrong with you. What's wrong is that the society does not educate its members about sex. Now, I understand there's some sex education, but you cannot take the whole concept of sexual human behavior and squeeze it into the two existing categories that are present in sex education, in the current sex education, and the categories being health science and family life. You just can't do that. Sexuality is much more intricate and more colorful. If your sex educators were your parents, your school, religious institution, doctors, mentors, you most likely didn't learn anything about sex, but just inherited guilt and shame about sex because they were not sex educated. In my 20s, I went to a male gynecologist and I told him that I was sexually active because that's what they ask you. I was sexually active, but I was sexually active with women only, which was hard for me to say at that point, and because I was scared of homophobic reactions. And I told him that I needed some help because I'm not orgasming. And his response is that I should try a man, then it will most likely and for sure, actually said for sure, it will happen. I ran out of that office and felt terrible about everything, about my sex, about my desire, wanting to have an orgasm, about being with women, you name it. So I wish he would have told me, that he would have educated me, that I can learn how to manage my arousal, that I can learn how to have an orgasm. I wish he would have been permission giving and more compassionate about my situation and more supportive about my lifestyle. So, not knowing about the intricacies of sex is not your fault. letting unqualified people, mentors and teachers, educate people about sex. That is the society's fault. Remember, sex is an activity, and it can and must be learned. It can be taught and must be taught. And that is exactly what you can expect when you go into sex therapy with a certified and board-approved sexologist. Not with a psychotherapist that has very limited sexual education, but with a sexologist that has been taught how to be permission-giving and non-judgmental, which is a big deal in this society. When you start sex therapy with me, a certified and board-approved sexologist, you will learn about the physiological, psychological, and the cognitive component of our sexuality. We call in sexodynamic as they evolve and influence each other. And the model of sexual health includes all of these interacting components and their harmonization. Whatever sexual challenge that you're dealing with, it planted its seed in one of these components, and it will be addressed, explained, and corrected with different behavior and different understanding. As you can see, sex therapy is a good thing and nothing to be ashamed about. Actually, it's the opposite, something to be proud about, because you have finally decided to get your long overdue sex education and to get help with your sexual challenges and evolve into the sexual being that you are and that you want to be. So together, let's toss out the window the stigma of sex therapy and evolve into healthy and happy sexual